Hello, so welcome back to another beautiful episode of my channel. So today guys, we'll look at pregnancy and uterine fibroid. We'll find out what happens in pregnancy if a woman has uterine fibroid. Previously I made a video on uterine fibroid where I talked about the meaning, the signs and symptoms, the causes, risk factors, complications. If you haven't watched this video, I'll leave the link in the description box. So do well to click the link in the description box to watch the video to get information about uterine fibroid, the risk factors, most especially, and how to avoid this uterine fibroid. Because if you're able to avoid the risk factors, then you are able to avoid uterine fibroid. Most women who have been diagnosed of uterine fibroids go on to have their normal pregnancy, but sometimes it can cause challenges. So these are the problems that we'll look at today. So I'm actually going to talk about the problems and the challenges that it causes to the pregnant woman during the first trimester, the second and third trimester, during delivery, and even after delivery. We'll talk about the challenges and problems that these women face during the different stages of their pregnancy. So I'm actually going to start with the first trimester. So let's look at the problem it causes during the first trimester. Most women who have uterine fibroid, it doesn't usually grow in size. So if it has to grow, then it has to be during the first trimester, because the body produces a hormone known as estrogen, which triggers the growth of this uterine fibroid. So some problems associated with the first trimester includes pain. The fact that the woman encounters pain due to the growth of the uterine fibroid. The second one is bleeding. There is hemorrhage. She actually tends to bleed due to the growing size of the uterine fibroid. And the last one is miscarriage. Women who have uterine fibroid tend to miscarry their babies, unlike those who doesn't have uterine fibroid. So these are the three problems that are commonly associated with the first trimester. So let's talk about the second and third trimesters. In the second and third trimesters, as the uterus expands to accommodate the size of the growing baby, it tends to push against the fibroid, thereby causing some problems to the pregnant woman. So the first problem that is associated with second and third trimester is pain. Yeah, I said pain is seen in first trimester, is also seen in second and third trimester. Pain is actually the most common symptom experienced by women who have uterine fibroid during pregnancy. So sometimes the fibroid can actually twist and cause abdominal discomfort and cramping for the pregnant woman. So the second one is placenta abruptio. What is placenta abruptio? In placenta abruptio, the placenta forcefully detaches from the wall of the uterus before the baby is being delivered. This is a serious condition because it can deprive the baby of oxygen, thereby leading to bleeding and even shock. So in this placenta abruptio, it's either the placenta detaches completely or it could be partial, and it's very serious when it occurs. So the third one is preterm labor. Women who have uterine fibroid actually tend to deliver prior to 37 weeks. So they tend to deliver their baby on time. They deliver earlier than the normal due date for delivery. So the last one is fetal growth restriction. Uterine fibroid can actually prevent the baby from growing at normal rates. And this kind of babies, when they are born, you find out that their birth weight is very low. So these are the things that uterine fibroid can cause during the second and third trimester. So what happens during delivery? Women who have uterine fibroid have increased chances of delivering with cesarean section. This is because the uterine fibroid tends to block the canal. It blocks the birth canal and thereby preventing normal delivery. It also stops the uterus from contracting, and once the uterus doesn't contract, normal labor cannot progress, thereby cesarean section is being carried out for them. Another potential problem is breech births. Uterine fibroid causes breech birth. What do I mean by breech birth? Instead of the baby coming out with the head, you find out that the buttocks and the feet comes out first. So these are the two problems associated with uterine fibroid during delivery. What happens after delivery? Studies have shown that there is spontaneous shrinking of the fibroid 3 to 6 months after delivery in about 70% of women who had live births. So the uterine fibroid tends to shrink after delivery. I believe this is all you need to know about pregnancy and uterine fibroid. If you do like this video, make sure to like the video, comment on the video, subscribe to my channel if you're yet to, and try to share it out to people who might also benefit from watching the video. Thank you so much for watching my video, and do well to subscribe before leaving. Make sure you come back to watch subsequent videos. See you again in my next vlog. Bye.